What is the Philadelphia chromosome's link to leukemia? Imagine a tiny change in our genes that can have a huge impact on health. That's what the Philadelphia chromosome is, a specific genetic abnormality linked to certain types of leukemia. It forms when parts of two chromosomes, 9 and 22, swap places in a process called translocation. This exchange creates a new, abnormal gene called BCR-ABL1. This fusion gene produces a protein that acts like a faulty switch, constantly telling cells to grow and divide without stopping. This uncontrolled growth is what leads to leukemia, a cancer of the blood and bone marrow. The Philadelphia chromosome is most commonly found in patients with chronic myelogenous leukemia, or CML. In fact, over 95% of CML cases have this chromosome. It's also seen in some cases of acute lymphoblastic leukemia, or ALL, and less often in other types of leukemia. When doctors look at bone marrow cells under a microscope or perform genetic tests, they can detect this chromosome. Finding it helps confirm the diagnosis and gives clues about how the disease might progress. From a diagnostic point of view, identifying the Philadelphia chromosome is a key step. Cytogenetic analysis, which involves looking at the chromosomes under a microscope, can reveal the translocation. Modern techniques like fluorescence in situ hybridization and polymerase chain reaction tests can detect the BCR-ABL1 gene more precisely. Knowing whether a patient has this abnormality helps doctors decide on the best treatment plan and predict how well the patient might respond. Thanks to this discovery, treatment options have dramatically improved. Targeted drugs called tyrosine kinase inhibitors block the abnormal protein made by the BCR-ABL1 gene. These medications can control the disease effectively, often allowing patients to live longer and healthier lives. In some cases, especially with ALL, doctors combine these drugs with chemotherapy and may consider bone marrow transplants to replace diseased cells with healthy ones from a donor. In summary, the Philadelphia chromosome is a genetic change that creates the BCR-ABL1 fusion gene, which drives the uncontrolled growth of leukemia cells. It is a hallmark of chronic myelogenous leukemia and appears in some cases of ALL. Detecting this chromosome is essential for accurate diagnosis and guides targeted treatment strategies that have transformed leukemia care. Always remember, if you or someone you know is dealing with leukemia, consulting a healthcare professional is the best step for personalized advice and treatment options.